My name is Ryan Defina. I'm the chair of the section and I'm your moderator today, and it's pleasing to be here. I'll just start with a quick housekeeping matter. Please keep your microphones muted if you're not asking a question, much appreciated. If you do want to ask a question, there's the usual means of doing so. You can type it in the chat box. We can raise your hand. So the speaker is comfortable with taking questions throughout the talk or afterwards, at the end during more of a Q&A session. So yeah, given that the session is being recorded, just please keep that in mind. Anything you say will be on YouTube forever. But beyond that, we certainly encourage everyone to be inquisitive and to ask questions of this fantastic speaker we have today. So to the speaker, Gabriel Kuyt, he's a government statistician and he's been an assistant deputy director in the public sector division of the Office for National Statistics since November 2022. Before that, he had held positions in DWP, the Cabinet Office, and the Department for Education. So his talk today, titled Government Output in the National Accounts, is fascinating conceptually how this is going to come together. So I'm really looking forward to it. In terms of what he'll be covering, he's going to talk through the way in which the ONS measures activity within the government sector, focusing on healthcare and education, but also covering other areas such as the fire service, justice and policing. He'll also outline the principles of measuring output in the absence of market prices, which is really important in national accounts, covering direct and indirect measurement, and how to approach the issue of quality of output and preventative measures. So where less output in that instance actually represents a better outcome overall. So the example, of course, is with the fire service. He's also going to introduce the ongoing public service productivity review, which should be really fascinating, commissioned by the Chancellor in the summer of 2023. So I'll stop there. I'll turn to the speaker. Gabe, we're looking forward to this talk. Thank you so much for coming. No, I'll turn to you.
Thanks very much, Ryan. Very good introduction. And good afternoon, everybody. Yeah, as Ryan said, I am Gabriel Kuyt, Assistant Deputy Director of Public Sector Division at the ONS. And I'm going to talk to you today about government output in the national accounts. So, brief summary, although Ryan's kind of covered this already, to be honest. And I really talk about the government output in the national accounts and what we measure, how we measure it. So I'm going to touch on direct and indirect measurement, hopefully give a bit of an outline of what we do with healthcare, and then talk about public service productivity review and also quality adjustment at the end, which I suppose are the kind of latest developments we've got in this space. I'm going to focus on how we measure government output rather than specific national accounts definitions and terminology. Hopefully this will make it more accessible and I would imagine more interesting to most of you, certainly more interesting from my perspective. So you'll get me being much more enthusiastic when I'm speaking, I'm sure. Okay, so government output, non-market output. So what do we mean by this? So principally, yeah, public services. In addition to public services, we're also talking about public corporations, charities, non-profit institutions. But this is where the Venn diagram of what is government and what is non-market don't entirely overlap. So I'm going to focus on government, so the rest of it's kind of out of scope for us today. It's approximately 20% of UK GDP, so it's pretty significant proportion. The UK, for context, ranks kind of right in the middle of the G7 for the proportion of its output that is non-market. So I've included the term non-market here to signify a broad binary split in how output is measured in the national accounts. So GDP is obviously trying to measure the entire output of the economy. So of course we want to measure the market sector, and we do that. In order to do that, typically we use a very well-known formula of output is equal to price times quantity. But the non-market sector is different and requires different intellectual challenges, and that is principally because we don't have a price paid for the service. So we can use a number of different approaches when measuring non-market output. So we use a combination, really. So we can use total expenditure, which is just the sum of costs in nominal terms. We can look at the investment in fixed capital, but also, importantly, we look at the volumes of activity. So that is the number of operations, children's in school, fires attended. So the Atkinson Review of 2005 was a pretty seminal moment internationally, to be honest, not just in this country, for measuring government output. He was commissioned to evaluate the full scope of government output, focusing on how direct measurement could be instilled. So prior to this review, most of government output was measured using an inputs equals outputs approach. So this is kind of what we mean by indirect measurement. I'm going to go into this in more detail in a second. So essentially, you get out whatever you put in. If you double your expenditure, you double your output. It's a reasonable starting point, but it's somewhat limited, not least because this doesn't enable you to measure any kind of productivity growth. So productivity is typically defined by the ratio of inputs to outputs. So if both these things are always equal, you just get constant productivity and you can't measure trends over time. In order to do this, you need to focus on direct measurement. So that is observing the services that are actually provided. And this was kind of one of the main points that the Atkinson Review came out with. But also talked specifically about the measurement should be underpinned by an agreed set of principles, and that public service output should be measured consistently with private sector output, i.e. with a focus on value added. And this is really key because this suggests that output should reflect both the quantity and the quality, not just how many pupils are taught in schools, but how much value you add by teaching them. And this is something I'm going to come back to later on. So indirect and direct measurement. Okay, so indirect is simply outputs equals inputs in nominal prices. So it's just the sum of the costs of production. So by those costs, we're looking at the procurement of goods and services used in production. We're looking at labour costs, and we're also looking at depreciation of capital. Direct measurement is just measuring the output in terms of the amount of services that are provided. So adding up GPs appointments, dental services, children in schools, etc. So the issue here is that both of these are kind of in nominal terms and do not account for the changes in the price level. So in order to get something that's more comparable over time, we have to look at something called volumetric measurement. So with non-market services, as we've discussed, there's no explicit price to construct a deflator. That is an instrument to remove the impact of the price level. So we've got two different choices here, and depends on how you've measured the output in the first place. So if you've used indirect measurement, what we do is construct a proxy for the deflator, typically using different sectors of the different components rather of the CPI or the PPI perhaps, and then use that to deflate your expenditure over time. If you've used direct measurement, we do something called converting into a chain volume measure. And in order to do that, we use the Laspeyres index. So this is a cost-weighted activity index, right? And this is consistent with international best practice on the measurement of non-market services. So the volume of public service output is measured, as I said, using a cost-weighted index, which measures the change in the number of services provided between current period and the base year, weighting each different activity by unit cost in the base year. So effectively, a chain volume measure values current output in the cost of the base year, and that allows you to make comparisons in real output over time. And you can see that in this formula. It's not. It looks quite complicated. It's actually not too difficult. It's just as you see, quantity in time t over quantity in time t minus 1 multiplied by the prices in both t minus 1, which is your base year. So what do we do in the UK? Broadly speaking, and this is not the case all the time, but it really depends on whether services are individually or collectively consumed. So for individually consumed services, we'd use direct measurement wherever possible. And whether this is possible or not is really determined by data availability. So this kind of measurement covers pre-primary all the way up to secondary education, much of healthcare and judicial activities as well, fire services, stuff like that. Collectively consumed services typically use inputs equals outputs, or indirect measurement. So that is the case with police, defence, public administration. So here are a few conceptual challenges, and this will kind of tease out why typically we use indirect measurement when it comes to collectively consumed services. But if you think about a fire service, would you say they were producing more output if they put out more fires? Or is their aim really just to be ready to attend any incidents that do occur? Secondly, incarcerating 10 prisoners takes exactly the same amount of resource as incarcerating 11. So does output rise with that extra inmate? And if by increasing resources spent on preventative measures, such as extra police on the beat, a reduction in crime and hence arrests follows. So how do you capture this in terms of output? And this is a really difficult conceptual challenge, right? Because it's very difficult to argue that a world where there are less arrests, all else being equal, is preferable. But you need to make sure that your statistics that are measuring your output really do capture this, and that is can be quite challenging. We've already mentioned quality adjustment in terms of the recommendation from the Atkinson review. So really what we mean here, we're not talking about the adjusting for the quality of the statistic. We're talking about the quality of the actual output itself. So an example here, so if you think about a country that maybe produced 1,000 mobile phones in the year 2000 and 1,000 mobile phones now, it's hard to argue that the latest iPhone is comparable with, say, a Nokia 3210 of 20 years ago. So that's really why it's important to adjust your output measurements for the quality of the outputs themselves. I don't want to go into too much detail on this, but the UK used to be bound by something called the European System of Accounts when it was a member of the European Union. Of course, the UK is no longer a member of the European Union, so it is now bound by something called the System of National Accounts. These two are primarily the same thing, but they fulfill the same purpose, and broadly speaking, they are the same. There are some key differences. One of those differences is that the European System of Accounts does not allow countries to quality adjust its outputs, whereas the System of National Accounts does. So now the UK is no longer bound by the ESA. The ONS is considering how best to quality adjust our outputs in the national accounts. But this is some some years away from implementation. I think later on I might mention this again. So let's have a quick look at what we do with healthcare measurement then. So measuring non-market output volumes in healthcare is approximately 8% of UK GDP in 2022, but that does include private healthcare, so not all of that is non-market. We use chain volume measures, that's a direct output measurement wherever possible. And this means that growth in treatments that are more numerous and more expensive have a greater effect on overall outputs than treatments that are less common or low cost. For example, a hip replacement will have a larger cost per activity than an NHS 111 call. So here are our outputs. So we look at all these different types of things, and this is actually slightly out of date. We've expanded our output since this slide was made, actually. So we've got hospital and community health services, outpatient consultants, community prescribing, NHS services, ophthalmic, dental practice, general practice, as well as a little bit from the independent sector as well. All of that added together is a kind of our total output. And as I said, we've recently added ambulance services, mental health services, and more community treatments into our measurements. And firstly, I do want to apologise for this chart. I would never normally produce a pie chart with this many segments, but I did, after some deliberation, settled on this being the best way of explaining what I was trying to do, which is that primarily hospital services is the vast majority of our output. However, there are some other smaller but still significant sections. So we have outpatient consultants, a bit on the independent sector, and general practice as well, are all reasonably sizable. So this table just shows it shows you the weights I just went through in that pie chart in this column, and that we used cost weighted activity. So that is using a chain volume measure for pretty much all of our outputs except the bit for the independent sector. It also shows you a little bit about the data sets that we use. So I don't know, some people may be familiar with some of these data sets already, and they're primarily admin data sets. So a lot of people, when they think of the ONS, think of surveys, but here is a good example of us taking use of good admin data as well. So here are a list of some challenges that we face when measuring non-market output volumes in healthcare. It'd be difficult for me not to mention COVID. So I wasn't working at the ONS during the pandemic, but it did completely change the way in which we had to measure healthcare. I think that primarily that is because the NHS completely changed on what it was doing and providing completely different services that it never provided up until that point. And so we needed to make sure that our data accurately reflected those changes from the NHS. I think that was obviously a significant challenge that's thrown up by the pandemic, but it's not unique to the pandemic. The NHS is always changing its outputs through medical advances or other reasons. So we need to make sure that the outputs that I mentioned on that previous slide are always updated and making sure that they are, as I said, accurately reflecting what the NHS is actually doing, and there's not significant resources the NHS is piling into certain outputs that we're not collecting in our data. Timeliness, again, is really important. We're always being asked to produce these things on a more timely basis. This really shot to prominence in the pandemic, though, and people were much more interested in more timely estimates of health output. And so we, whereas before we used quite a significant amount of forecasts when producing our monthly estimates, we now use actual observed activity data wherever we can, and we always try to update this. This is obviously dependent, though, on what the NHS and Department for Health and Social Care can actually publish, and also what we can process internally, because obviously we don't have very much time to do that when producing our monthly estimates. So I've mentioned preventative measures a little bit, but it's obviously particularly significant in healthcare. And I've got an example to talk through. So take type 2 diabetes, which is typically, but not always, but typically caused by being overweight. So you could have better information campaigns targeted at schools or subsidised sport, better access to leisure facilities, that kind of thing. That could have an impact on obesity rates, which in turn, obviously with quite a significant delay, might lead to a reduction in cardiovascular operations, which is obviously a really, really good thing. But it is an example of less output being a better outcome. And that isn't necessarily reflected in these figures. And it is really, really important to try to do that, but really, really difficult to actually do that. And that is a kind of, it's an ongoing thing that we're trying to improve. And we've actually got some work with the ESCO on trying to come up with an agreement on how we should approach this going forward. So I'm going to talk now about the Public Service Productivity Review, but it's an important caveat to make here that we're doing a slight pivot away from what we've been talking about previously. So up to now, we've talked about the national accounts. Here, I'm going to show you some statistics from our own productivity series. So that's slightly different. So national accounts are, one of their main purposes is international comparability, which is why we have to follow the system of national accounts and try to make sure that what we're doing is directly comparable with other countries. With our own statistics, we obviously have a lot more freedom to do what we want with it. And so the two things are broadly the same, but not entirely. And I was trying to show you a few things in a few ways in where they're not the same. So the productivity review was commissioned by the Chancellor, and he's commissioned the National Statistician to review how public service productivity can be measured more effectively. So this is a cross-government project, and the idea is that we're trying to maximise the impact of current public service productivity methodology by improving data and methods all across government. So our primary objectives are to review the current measurement of inputs and outputs of public services, publish an assessment of baseline productivity and growth trends, increase the proportion of services that are measured through direct quality adjusted output, and then also quality adjust outputs in the national accounts. So how do we measure productivity? So really, it's in a simple terms, outputs divided by inputs. What are you getting out? What are you getting in? So if you increase your outputs for the same input, you're more productive. If you get out more and put in the same, then you are being more productive. But quality is really, really important, as we've kind of mentioned already. you won't get politicians bragging about having an extra 20,000 children in school. You will, though, get them talking about their increase in outcomes. So they'll brag about the increase in outcomes. They won't brag about something that's a product of population changes. So that kind of quality adjusted outputs makes up our numerator. Our denominator is just the sum of all our costs of production, so labour, capital consumption, and intermediate consumption, which is just procurement of goods and services used in production. So here is a slide which shows what we're doing at the minute in terms of how we measure our outputs. Really what we're looking for here is more the blue being good, green being not so good. So as you can see, the healthcare and education is broadly measured through quality adjusted direct output. There is quite a lot of work to do with other, which is mainly just public administration, so kind of like government service, like government itself, and defence and police as well. And police is one of the area in which we started looking at already. So let's look at healthcare again as an example for with productivity. So here is the same output slide we've already seen. These are our inputs. So as I said, we've got labour inputs, procurement of goods and services, and capital consumption. We're actually able to measure labour directly, so we can look at the volume of labour itself measured in full-time equivalents. But procurement of goods and services, capital consumption are indirectly measured using deflated expenditure. So quality adjustments then. So as I mentioned, the purpose of a quality adjustment is to better determine the value of an output in instances where there is no price to determine this. So primarily, this represents how well an intervention, the aims of the intervention were achieved. So was the operation a success, basically? But also customer satisfaction as well. And that's an important determination of the value of a service. So we could do that with healthcare in a few different ways. So when we look at what outcome is achieved, and we look at kind of whether that outcome was intended or not, we can use something called a quality adjusted life year, or QALY, patient reported outcome measure, or looking at the impact on life expectancy. Quality adjusted life years, patient reported outcome measures they're not doing the same thing as looking at life expectancy, but for the sake of this description, they are really, it's looking at kind of the impact of the procedure on the patient's life, or the kind of an outcome of the operation, I suppose, or the procedure, whatever it might be. We can look at how the outcome is achieved. So that's through patient experience surveys. And also when the outcome was achieved. So looking at waiting times and cancellation rates. And here is a chart showing productivity in healthcare from 1997 to 2020. It'd be a lot easier if this chart just ended in 2019, to be honest, because as you can see, COVID's had quite a big impact there. So what's probably important to look at here, though, is this this line here, this black line at the top and the lighter blue line. That is the difference between the quality adjusted output and the non-quality adjusted output. Here is the inputs line, the dark blue line, and the green line at the bottom shows productivity, which is just quality adjusted output divided by inputs. As you can see, COVID has wreaked havoc here, where inputs shot up. So the government throwing lots and lots and lots more money at the NHS, but outputs fell quite considerably because the NHS was no longer providing lots and lots of the services that it did typically for one reason or another. All that led to a quite a significant drop in public sector in healthcare productivity. So that was all of my slides. But very happy to take any questions.
Oh, excellent. Thank you. Thank you so much, Gabe, for your presentation. Really interesting stuff. So yeah, as he's mentioned here, we have time for some questions. If anyone is game, feel free to unmute your microphones to ask a question or put something in the chat box, and we can put it to the speaker. Maybe I'll make a start then, if everyone's a little bit shy. So I was really interested in, and you touched on it in one of your last examples, around the subjectivity of looking to measure quality. And I mean, I used to work at the Australian Bureau of Statistics, and so I recall the tensions around assessing what you feel is a success, sort of moving in the direction of almost public policy objectives, which can get overtly political, can change over time. And you're working for an independent institution that is really not in that business per se. So I'm very keen on how you navigate this tension between assessing what is an appropriate measure of success while remaining as objective as possible, to ensure appropriate comparison across jurisdictions, to not be seen as offering a particular perspective beyond your mandate. I'd be keen to know more about that, actually.
Thanks, Ryan. That is a great question. And it's a great question because it's very, very difficult to do. I think that's a large reason why the European System of Accounts doesn't allow quality adjustment, and why people have been potentially quite hesitant to apply it in the national account. I think, in my experience, you want to try to remove subjectivity in terms of a kind of a hierarchy of outcomes by speaking to people that are more independent experts in the field. We do try to remove politicization wherever we can. It's quite difficult to do that because a lot of published statistics are political in themselves, in that politicians have commissioned their production. So it is very difficult to disentangle the two. I think it's good to use a kind of variety of different things, as I kind of explained there, where you're looking at the qualities, the waiting times, and then also patient experience surveys as well. But yeah, the truthful answer to your question is there's not. It is very difficult to do that, and there's not a kind of one-size-fits-all approach to doing that, and you need to really look at each case individually. I don't know. Did you have any experience of doing something similar when you were at the ABS?
I didn't work necessarily in this space of national accounts, but I worked on a lot of the inputs, and yeah, I think it's a fascinating area in that sense. I'm not expecting you to be able to answer that question. It's quite esoteric in some respects, but it's a good discussion, I feel. And I thought that your point on utilising patient experience surveys was a really good one, around getting a sense of what is success while very much taking an objective perspective on it. So I thought that was fascinating within that context. But then, of course, there are other sectors where you don't have that luxury, I suppose. So
it's not always appropriate, but where it is, I think, and you've got reasonable data, it's a good idea. I think that the difficulty becomes whether what a patient or the person in particular who's receiving the service has a different expectation around the service than maybe the government does themselves. So I'm a crude example, maybe in vaccinations. So the government is really interested in a public health perspective, whereas a patient will, if somebody's particularly, the person administering the vaccination is particularly rude to them, they will come away from that thinking they've not had a very good experience, whereas the government will think, yeah, but you're not spreading something else. So we're quite happy with what's happened.
Yeah, I think that's a really good example. You've also got to be careful, that you're not being biased in a particular direction by incorporating these things. So we're getting some questions coming through, which is fantastic, and thank you to those contributing. So Simon has a question here he's put, and I will quote it. To make it easy to understand the many components and how they change over time, will you publish all the inputs to each component of public sector output when you publish the quarterly figures?
Yes. So we published lots and lots of things. So in theory, everything is published. It just depends on what kind of level you're talking about, really. But in terms of what we actually add up to create our inputs, yeah, that is all published. Most of our expenditure data comes from a data set called OSCAR, which comes from the Treasury, which is not published at an individual level anyway, on an individual line level. But in terms of our inputs, all of that should be available. It's not the most easy to navigate. If there's something in particular that you're looking for, then you're very welcome to get in touch, and I can try and help you out with that specifically. But yeah, in theory, most of it should be publicly available. Does that answer your question, Simon?
I'll take that as a yes, I suppose. I think everyone wants more disaggregations more often, don't they? Everyone wants to be able to draw cause and effect. And
sorry, it's Simon here. Sorry, it took me a moment to get back on the screen. No, I think what I was meaning is that if you could, I've no idea, but if you publish an A4 size PDF with a handful of components of the healthcare output, you've got the statistical time series there that allow you to see how each of the bits was changing and leading to the aggregate. What I'm really saying is, can you do that back to all the detail so that, I don't know whether you've got 5 time series components of health or education or 500, but it would be publishing each of them so that a user can, in a sense, recreate your aggregate figures from the components that you publish. So I think in that sense, it's years since I've looked at the OSCAR database, but that's not really what I mean. It's being able to understand how you derive your aggregate figures and which components are driving it, rather than having to rely on the relatively small number of components that the ONS publishes with the commentary that the ONS chooses to put, which often is not the commentary you might be interested in having.
Mm-hmm. Take your point. So the productivity review is looking at reviewing all the inputs and outputs, and as part of that we are looking to publish quite extensive data on baselines of productivity, and stuff we have been doing internally, which is not ready for publication, is doing exactly what you say, like looking at kind of growth accounting. So looking at the changes in productivity over time, and then dissecting that into what is driving the changes in the inputs, driving the changes in the outputs. Quite whether it will go as granular as what you are seeking, I don't know, and whether you will find the commentary to your liking. I can't comment on that, but I'd be happy to kind of take any specific questions offline if that's helpful for you.
Okay, yeah, sorry, I just have one brief comeback, but I think the reason why this is important is that, when you look back at the COVID period, there was a lot of chat in real time about how the UK economy had been hit harder by COVID than the countries you would normally compare the UK with. Now, over time, two things transpired. Firstly, a chunk of that was to do with the outputs in the public sector, which, as you said earlier, changed and some declined. And then the second thing that happened is the rebound was stronger because, of course, all those hip operations, whatever you mentioned, which didn't take place, then took place. So it bounced back. But I hear what you say about having to have a review and everything, but I think that was quite a major failing of the ONS because it gave a completely incorrect steer over what's happening to the economy during COVID relative to others. And you even see it today in the COVID inquiry, the fact that actually that large fall in the UK relative to others was a statistical artifact rather than something that happens in the real world. It has still not sunk in on people whose interests are in trying to show, for whatever reason, that the UK response to COVID was bad or worse than others. So, I mean, it's fine. You can say, well, we might do it, but I just don't understand why you don't do it. I mean, this is meant to be sort of open, transparent, reproducible pipelines, all the rest of it. And yet we really don't have much of a clue as to what's driving the ups and downs in these figures.
So I don't really want to just sit here and defend the ONS, particularly. I don't really think that's a good use of our time. But what I would say is I take your point. Always interested in being more transparent and publishing stuff. I think we do publish what we can and what we think is of a high enough quality and of use to our users. But I do think there is more we can do. I think with regard to your criticism of the ONS during the pandemic period, I think what I would say in that is it was highly, highly challenging for everybody involved. And in hindsight, I'm sure there were lots of things we would have done differently, but we are trying to react to things in very, very quick time. And it's not as easy to make the absolute optimal decisions in those circumstances.
Okay, then. All right. Well, we'll move on to the next question. Been provided. It's quite a long question here, actually, from Sally Gainsbury. So, Gabe, could you talk about how the approach to measuring healthcare outputs might be adjusted to reflect COVID? So, for instance, earlier on, you gave the conceptual problem of a fire service measured on fires attended versus being ready to attend fires, which may or may not occur. An analog scenario here might be a health service that cancels much of elective activity during a pandemic. So we were touching on this just then, in order to be ready to receive COVID patients. So it's like availability is a sort of output during that time, at least in terms of the public very much wanting to know that hospitals will be able to receive COVID/pandemic patients if required, but obviously a very different output. So there's actually a lot to unpack in that question. Any thoughts?
Okay, so I think primarily it's about adjusting your output measurement. So the best example of this is testing, tracing, and vaccination. So we went from obviously never recording anything to do with testing, tracing, vaccination to having a monthly briefing on exactly what impact it was having on our overall GDP level, which we've only recently ceased from doing, and that is primarily because there isn't any very much testing or tracing anymore. It's just a vaccination campaign, which is being wound up into kind of something that's closer to intermediate consumption now anyway. So yes, that's the that I think is the kind of the main thing that we looked at was really an assessment of our outputs. Sorry, I'm just trying to digest if there was a second half of that question. I think there was about availability. Yeah, come on. Yeah, come on.
So I think that the thing I'm really interested in, and this could just be, well, it's very likely to be a stupid question, but I just wonder if there's an economics literature on it. So there was a point, particularly in that first year of the pandemic, where the statisticians were looking at the likely number of people who might need oxygen in hospitals, and it's all about, can the hospitals cope, will the NHS be overwhelmed? And there was a period where the NHS was very deliberately emptying, stopping a lot of elective activity, discharging people, in order to have that availability should we reach that point. And to Joe Public, that was quite a valuable thing. It was certainly terrifying to the public to think we might be overwhelmed to the extent where people would be turned away from hospital despite having very severe COVID. And also, I mean, we were seeing a little bit with it, being revised around the COVID inquiry. There was kind of a bit of an interplay between, how much economic opening, for example, we could have. That was partly dependent on the availability of the NHS to be able to cope with another surge in COVID cases. So, is there a way in which, the availability of being able to take in COVID patients, regardless of whether or not that happened? Because in fact, I think I'm right in saying it never quite got to the scary point we thought it was going to be at, but partly because those elective procedures were cancelled and we ended up replacing a lot of hip replacements, with quite a high value. I've seen the reference cost value for a COVID inpatient. It's actually not huge. And so then obviously you lose a lot of output in the traditional way of measuring it, and it got replaced. What it replaced had a much lower output value. I'm just wondering if there is kind of a literature or if there's any thinking around attributing a value to that availability.
So the COVID example, it was obviously a really good example. In terms of any changes that were actually made as a result, I don't think that, although don't quote me on this, that the overall government output was reflective of the capacity within the NHS to deal with certain situations. That should be really picked up in something slightly separate, and is not really what we're trying to measure. Whether there are merits to that or not is a very legitimate argument, but given that COVID was a relatively small amount of time when it comes to kind of these things, it wasn't possible, or what might well have been possible. It wasn't the outcome that we changed the way in which we to try and pick up the capacity issue. It is, though, a very interesting kind of conceptual challenge, and something I mentioned as one of my examples at the start, actually, with respect to the fire service. So if there just happens to be 3 fires in one night, is that a greater output, or are you really just interested in the number of fires that you can actually attend? We measure the fires that are attended, but I think there's a acceptance that that's probably not entirely the best way to do it, and we'd like to try and have a look at that and look at the available statistics that we could use to maybe make an improvement there. Does that answer your question?
Yeah, thanks. It's really interesting. I'm going to have a look at the fire service analogy, because it seems quite similar. But I take your point. It wasn't a criticism of ONS. It was a pandemic. It was a once in a century thing. But it's just, I just wondering about, like, retrospectively, if there are adjustments, or if there's an analysis that could be done that would take it into account.
Yeah, there probably is some literature that I'm not completely on top of, so I can try and have a look at that. And if I find something, I can send it around.
That'd be brilliant. Thanks.
You're welcome.
Okay. I was going to ask a question here about the extent to which national accountants are probably using more administrative data than ever before. And when you overlay this notion that NSOs are now publishing material on certain subject domains, particularly quickly, I would argue, particularly compared to, say, a decade ago. My question is around confronting different sources of quality in the inputs that you're using for your national accounts compilation. So, of course, you'll be running surveys yourselves, which will be of tremendous quality. You'll be receiving survey results from other government departments, which may or may not be of the same level of quality. And presumably you're even getting private sources of information that you're incorporating to some extent. So yes, I'm wondering how you manage that risk. Assuming it doesn't all just come out in the wash, you do need to be conscious of these elements, particularly given that, as we're seeing from the questions here today, people are very interested in the details, the granularity. How do you go about managing that risk?
Well, it's quite prominent actually that the ONS revisions at the minute, and it's made quite a few headlines over the last few months or so. So we are always revising and our estimates. So we will be. A lot of our admin data sets do get revised themselves. So we will take on that extra data, and that'll kind of, as you say, a lot of that on an individual level anyway, will get a lot washed out and will come out in the wash. But we have seen some quite significant revisions to our headline GDP recently of nearly 2 percentage points. And most of that wasn't public sector actually, but some of it was healthcare. So I think it's just it's using multiple data sets, making use of the kind of the multiple publications of what is essentially the same thing. So we've got, obviously we publish monthly GDP, we publish quarterly GDP, of which we do a first quarterly estimate halfway in that quarter. And then we also publish annual GDP, which is where we kind of balance everything out together. We hold the open period out for much longer, so we can take on additional revisions. So if data sets get revised kind of 3 or 4 years after for one reason or another, we're still able to take that on and adjust our back series accordingly. Okay then. Well, I think we're actually running out of time here, unfortunately. It's been a really interesting session, and it's been a great pleasure to have you here today, Gabe. So thank you so much for your time, and it's always great to hear what the ONS are up to. And this is a really interesting area of work, and we look forward to seeing the results of this work as you promised, with many new and interesting initiatives on their way. I'll take this opportunity to, of course, thank everyone that's joined us today. Thank you for engaging with the speaker and offering some really tough questions. I think some things that's left us all having a little think about this topic moving forward. So thank you so much, and I'll at this point I'll say goodbye. I wish you a very good afternoon. Okay, well, thank you, Ryan. Pleasure to be here, and glad it was of interest.
Thank you, and
thank you. Bye bye.